When we come back, a new warning about a summer pest. Canada's exploding population of ticks and the dangers of Lyme disease. There is a new warning tonight about the spread of Lyme disease. People get it from bites from infected ticks. It's often hard to diagnose. There can be extreme fatigue and rashes, and in many cases the symptoms are even worse. As Ross Lord reports, an explosion in the tick population is putting more Canadians at risk.
The baskets full of medication and the piles of paper document a decade of pain. For Lois MacLean, a real estate agent in Toronto, contracting Lyme disease has been devastating.
I would get lost. I couldn't concentrate. I couldn't read, comprehend. My eyesight was failing. No reason could be found. And I had memory loss. I stuttered. I lost the ability to find words.
A victim of what health authorities call an emerging disease, typically acquired through incidental contact with these ticks.
But in the last 5 years, we've seen a tremendous expansion into new areas.
And more ticks in more locations means more Canadians are falling prey.
In 2011, there were 258 human cases, and that was up from the previous 2 years. So we're definitely seeing a trend in the upward direction.
In the Maritimes, researchers say a growing deer population is a big contributor, providing ticks with food and transportation.
You can probably acquire Lyme disease now throughout much of southern Ontario, southern Nova Scotia, southern Quebec, areas of Manitoba, southern British Columbia, Vancouver Island.
This University of Toronto researcher says there's another big factor: warmer weather.
The places that have Lyme disease going up and up are actually the places that are farther north and colder, that may be warming up as a result of climate change.
Along with more active searching for ticks, health authorities are encouraging Canadians to take precautions, like using insect repellents and covering exposed skin in wooded areas. But for many of those already infected, support and treatment is an exercise in frustration. Lois MacLean says she's seen dozens of doctors and scores of wrong diagnoses during her agonizing journey.
I think the thing that is the most hurtful is a lack of respect that the medical profession treats Lyme patients with.
She's planning to sell her house so she can afford the $10,000 a year cost of her treatment. A terrible price to pay for a disease that's afflicting a growing number of Canadians. Ross Lord, Global News, Halifax.
For more on the symptoms and the health effects of Lyme disease, you can go to our website, globalnews.ca.